Good afternoon, everyone, and welcome to yet another To Talk with Your Dentist on thedentaire.com. And I am Dr. Rekha. To all of you all who have been following this program, a warm welcome to you all, and thank you for your continued support and all your queries. And for those of you who have tuned in for the first time, I would like to tell you that the To Talk with Your Dentist is a program to create dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. And do invite your friends to join our Facebook group and do subscribe for our YouTube channel so that you get your updates about the dental health program. So thank you all again and a warm welcome. So in today's talk, I would like to share with you some information about loose teeth or mobile teeth. Why our teeth can become loose or mobile. Now, there are various reasons why your teeth can become a bit shaky in the mouth, but predominantly the most common cause why you can have loose teeth in your mouth is because of gum infection or what we call as periodontal disease. Now, what are the symptoms? What would you feel when you have loose teeth in your mouth? Now, a tooth becoming loose in your mouth is a very gradual process. It is not something that happens overnight. So you have to be aware that when the symptoms first start, you have to visit your dentist and get your checkup done regularly. Now, what are the symptoms that you will, or the signs that you will see that is the initial or the first stages of a gum infection? You will have bleeding from the gums. You will have a slight swelling in the gums. There may be redness in the gums. The gums may feel more spongy in nature. It may bleed whenever you touch your gums or whenever you brush your teeth. So these are the initial signs that you should not ignore or neglect, because this is the first stage of your gum disease, which is called as gingivitis. At this stage, you have to visit your dentist. Your dentist will do a round of cleaning or oral prophylaxis and put all the infection that is just starting in your gums under check so that your gums get back to normal health, which is a coral pink in color. It's a firm coral pink in color. So what happens if you neglect or ignore these signs and symptoms? The disease or the infection which is in the gums then proceeds to a much deeper layer of your gums and then goes to infect your bones. So what happens is, even here, it is a long process. It's going to take months or maybe even years for some people for the disease to progress to this stage and go to the advanced stage of this condition. And this is called as periodontitis or severe gum infection. So this time when your bone becomes infected, the supporting structure for your tooth is lost, and that is when your teeth become loose. And that is when you actually notice that the teeth have become loose. So, but the fact is that your body is giving you so many signals beforehand that the infection is developing. So do not neglect these signs and symptoms and ensure that you visit your dentist regularly, say once in 3 or 4 months, get your checkup done, get yourself checked, and put all these signs and symptoms under control. Now, gum disease is one of the most common causes of loose teeth. Another reason why you can have loose teeth in your mouth is because of trauma or fracture. Now, trauma or fracture can happen because of various reasons. That is, if you have an accident and you have a major hit or a fracture in your jaw, that is when your teeth also can become loose. Or sometimes what happens is during games, contact sports, or maybe because of an accidental fall, your teeth can again become loose. Or sometimes if the teeth is very badly decayed and the decay process, has separated the tooth from the underlying supporting structure, which we call as the root, even then your teeth can feel a little shaky in the mouth. Another reason why you can have loose teeth is bruxism or clenching of your teeth during night times. Now, there are other reasons which we call as probably temporary or physiologic tooth mobility. That is, one thing is when you wake up first thing in the morning, you may have some looseness in the mouth, which is normal and which becomes all right over the day. Now, what happens is milk teeth. When it's time for the milk teeth to fall off, that time it can be loose. Now, these are all normal physiologic processes. Now, one more condition where you can have loose teeth is during pregnancy for women. Now, because of the hormonal changes, there can be some changes in the supporting structures of your teeth, which are the gums, and because of which your teeth have a tendency to become a little loose. But I should tell you here that pregnancy by itself does not cause loose teeth. It is neglecting your oral health during pregnancy is what actually initiates and causes a gum infection and makes your teeth loose. So ensure that even during pregnancy, you visit your dentist regularly, get a checkup done, get your routine scaling, filling, and those procedures done, which is absolutely safe. And also, studies have shown that a severe periodontal disease or a gum disease can make your child to be of a lower birth weight. So it is really important that you visit your dentist regularly. Now, what are the other symptoms that you would feel if you have loose teeth? You can, of course, one is bleeding gums. You can have pain in the gums. There can be tenderness in your gums. And you can have food lodgement. The food that you eat can probably go and get stuck between the teeth. Now, another reason why food can get stuck between the teeth is also if there is a decay, tooth decay that is there between two teeth. So you have to visit your dentist, get a check done, and find out the cause of your food lodgement in your mouth. Another symptom or sign that you will notice is bad breath. You can have foul odor from your mouth. This is again because if there is tartar deposit, that is the hard yellow color deposits that you see in your mouth that does not go off with your brushing. Now this leads to damage in your gums, and also because there is a constant harboring of bacteria in this tartar, it can cause bad breath. Now there can be pain in the gums, and you can have difficulty in chewing and eating, in applying pressure when you chew. And you can have what we call as gum recession. That is, the level of your gums will reduce. You may not have all the other associated symptoms. It may be just gum recession, that is the level of your gums is going down. Even then you will have to visit your dentist and get a checkup done. Another sign that you will notice in your mouth is what we call as extrusion or drifting away of the teeth. Either your teeth can come out of the level from the adjacent or the remaining teeth, or they can move apart from each other. So if you notice any of these signs, please do visit your dentist immediately. Find out the cause for it. Your dentist will suggest and recommend the treatment options for you. Please get it done so that you put your mobile teeth, you put all the signs and symptoms that would lead to a mobile teeth under check immediately. Now, what will be the treatment options? So just in case it has happened that you have neglected it, you have ignored it for whatever reasons, and it has reached a point where your teeth have become mobile already. So what are the treatment options that are available for you to treat and rectify a mobile teeth? One thing is that if it is a very slight mobility of your teeth, your dentist may do a procedure called as teeth splinting. Teeth splinting is a procedure where the mobile teeth or the shaking teeth are stabilized. They are stabilized with the help of what we call as using the adjacent firm teeth. So we can use a splint material, or sometimes your dentist may go ahead and do a capping procedure where the caps are attached to each other and the mobile teeth are stabilized. That is one option. The second thing is, if you have bruxism or grinding your teeth at night habit, then your dentist will fabricate a night guard for you, which you can use it at night, and it will take off a lot of load that is falling on your teeth during the night. At times, what happens is we do what we call as occlusal adjustments. There may be some cases where the teeth kind of touch prematurely. They kind of touch each other a little earlier than the rest of the teeth. So in such occasions, we do what we call as occlusal trimming, adjusting the bite. So with that also your teeth mobility can come down. Now, if the cause of your mobile teeth is because of a gum infection, and your dentist notices that there's a lot of tartar deposit, either supragingival, that is deposit that is above the teeth, or subgingival, or if there are even deposits underneath within the gums also, which cannot be normally seen, then he will recommend a round of scaling or oral prophylaxis. So once this procedure is done, we will probably wait for some days for the gums to undergo some amount of healing, and then probably a second round of cleaning may be required. And this time around, your dentist may recommend and ask you to go for what you call as a deep cleaning procedure, which we call it as root planing and curettage. So in root planing and curettage, what do? We clean the subgingival tartar. Like I said, there can also be tartar deposit that happens within the gums, deep inside. So in root planing procedures, what we do, we remove that subgingival tartar, and we also scrape off the surfaces of your root where there could be diseased or infected tissue and infected material. Now in curettage, what do? We clean the surfaces of the gums, because there is infection in the gums which is actually causing the damage to your gums and the adjacent bone. So there is some amount of scraping of the inner layer of the gums that we do. So once this is done, we again let the gums heal for some time, wait for some time and see how it goes. Of course, in the meantime, you have to do meticulous oral care, like using your mouth washes, using the interdental cleaning, like cleaning between the teeth with lot of aids. Aids are available today to do the cleaning in between the teeth. Like you have your dental floss that is available, you have interdental brushes, then you have oral irrigation devices. So you'll have to ensure that you do meticulous oral care. So sometimes what happens, most of the time, the gum infection may come under check at this time, and maybe even up to 50% of tooth mobility may be reverted. But sometimes what happens is, if there is a more severe damage that has happened, your dentist may decide to do what we call as a small surgical procedure in that area. Now, the surgical procedure is what we call as a flap surgery, where the gums are opened up and a more deeper cleaning is done. And these days, we use what we call as laser procedures to do the cleaning of this gum tissue. Now, laser procedures are very convenient in terms of post-operative care, where bleeding is very much minimized post-operatively and healing is much faster. Of course, according to your convenience, your budget, and of course, the possibility of a laser treatment in a particular area, you can sit and discuss this with your dentist and get your treatment done accordingly. And also sometimes your dentist may feel, or your periodontist who is a gum specialist, he may feel the need to place some artificial bone, which is bone grafts, in certain areas of the mouth to let the bone and the gums heal in that area. So these are all the treatment procedures. So whatever treatment happens, one thing I have to emphasize and tell you all is the requirement for a meticulous care in your day-to-day routine, like your regular brushing, flossing, rinsing the mouth, and care like that. Now, what are the preventive measures that you can take to avoid a loose teeth in your mouth? Like I said before, brushing and flossing regularly is a must. Any form of interdental cleaning, either flossing, interdental brushes, or oral irrigation devices, whichever you find is most convenient for yourself, please use that. Even while using the brushes, you can use the conventional normal brushes or the powered brushes, whichever you think is comfortable for you to use. Then avoid smoking. Anything that causes dehydration of your oral tissues, you have to avoid. And then visit your dentist regularly, say once in 4 months, to get your scaling procedures done, and any deposits that is happening here and there, your dentist will remove it so that you are safe and home. And of course, using mouth guards or sports guards. When people with bruxism, you can use night guards, and people who are into contact sports, you can use what you call as sport guard. And like I said earlier, in some conditions like pregnancy, again, meticulous care is the key to good oral health throughout your pregnancy. And one thing I would like to add here is that people who are diabetic are more prone for a gum infection. So people who are diabetic, so please ensure that you get your sugar check done regularly, and also visit your dentist regularly, so that any little signs that are developing that will cause either gum bleeding or a gum infection is put to check immediately. I hope that talk was helpful. If you have any queries or questions, do post it to me, and write it to me in the comment section below, and I will get back to you on that. So see you again on the Tooth Talk with your dentist next week, with another colleague of mine who will come and talk to you about oral and dental health. So till then, take care and keep smiling. Thank you.